How common is erectile dysfunction? Well, you might be surprised. Erectile dysfunction, or ED, means having trouble getting or keeping an erection that's firm enough for sex. It can be physical, psychological, or a bit of both. Sometimes it's a sign of a deeper health problem like high blood pressure, diabetes, or obesity. Other times stress or anxiety might be the culprit. But let's get to the big question. Just how many men deal with this? Turns out, that's actually a tough one to answer. Studies show wildly different numbers, partly because the definition is a bit subjective. In a recent review, researchers looked at 41 different studies from around the world. The rates of ED ranged from just 3% all the way up to 76.5%. That's a huge spread, right? So, why such a big difference? It's mostly because different studies use different tools and questions to measure ED. For example, one popular questionnaire, the International Index of Erectile Function, found rates from about 13% to 71%. Another survey used in the Massachusetts male aging study showed 15% to 69%. And other tools gave even bigger swings. Basically, how you ask the question really matters. Plus, where you live can make a difference too. In Europe, the rate ranged from 10% to 76%. Asia saw 8% to 71%. North America wasn't far off, at 20% to 58%. Cultural factors and willingness to talk about these issues play a big part. Some people just aren't comfortable admitting they have ED, even on a survey. Now, here's something even more important. ED isn't just about sex. The researchers found a strong link between erectile dysfunction and cardiovascular problems, things like heart attacks, hypertension, strokes, and clogged arteries. Men with ED were also at a higher risk of dying earlier, including from heart disease. But, and this is key, most of these studies were taken at just one point in time. That means we can't say for sure which comes first, ED or heart issues. It could go both ways. What does this all mean? First, ED is very common, probably more than people think, and it can be a warning sign for more serious health problems. That's why doctors suggest screening for ED, especially if you've got risk factors like age, obesity, diabetes, depression, heavy drinking, or smoking. Bottom line, if you or someone you know is dealing with ED, don't brush it off. It's not just about sex, it's about your overall health. Don't be afraid to talk to your doctor. Thanks for watching. Take care of yourselves and each other.